Hi, I'm with a nurse. Her name is Sheila. She's visiting from Sweden. She's how long? I'm at the refugee camp. What is the name of this refugee camp?
Bashod Kandal.
Bashod Kandal.
Yes.
And how many refugees there are in this camp at the moment?
There is two Bashod Kandal number 1, who is in the other side. And this is Bashod Kandal number 2.
I see.
And here they are living around 8,000, 9,000 people.
8,000.
Yes.
And so in this, you're the Swedish hospital made a clinic, right?
Yes. I'm working in a Swedish hospital in Erbil, and we have make a clinic here for the people who is living in Bashod Kandal.
I see. Yes. I see. What is the major problems that you face in these refugee camps? What is the most needed items at these refugee camps?
Right now is they need everything actually. Even they need medical things, medicine. They need toilet. They need shower, shower cabin. There is a lot of things that they need.
Okay.
But this is like the thing that is very, very important for them right now, that they are asking for.
I see.
Yeah.
I see. So basically you're asking the international community for more assistance, right?
Yes, of course.
Okay. This is the director of this clinic, Dr. Lokman Atrishi. Dr. Atrishi, what are the conditions of the refugees in here, and what are the urgent needs for international community for this camp? What do you think, doctor, we need?
In this part of the camp, which we call as Bashod Kandal too, we have about 10,000 people.
Okay.
IDP people from the Shengas, all of them is from Shengas area. And about 70-80% of the people here, they are kids. As you see, a lot of kids. I see lots of kids. Yeah. And after the 4 months, more than the 4 months, still they have very primitive conditions of their life. Still they share one toilet for 50 people here.
I see.
They haven't warm water. They have in the kitchen, and when you see our field clinic is very, very primitive clinic. We have not many things. We have not electricity. We have not a lot of the medicines. So it is just, I can tell you, it's a terrible situation. I call it the camp, refugee camp, but actually it's not the refugee camp, it's a city. Because just this part and another part together, they're living there about 20,000 people. So to use the camp's word maybe is not the correct one. Let us see a city in the tents, that is maybe more right answer to that.
So now that we are getting too close to the winter, what are the medical needs and what are other stuff that possibly urgently needed for this camp?
As you know, the winter already is here, and we have a lot of the people with the infections because they have not any warming research in the tents. It is cold, and the night it can be minus grades, So many of the kids, they have the catch cold, they have the pneumonia, and many other infections. So we need a lot of the antibiotica for these people to can give them. We need the cough medications, and even we have a lot of the chronic care with the diabetes, with epilepsy, with hypertension, which those kinds of the medication is very expensive in this part of the world. So we need almost everything.
Doctor, why did you decide to open up this camp? I mean, how did you being a doctor from Sweden, how did you get involved in helping these Yazidis refugees over here?
You know, it's like this because the crisis was very big. I was here in the beginning of the August, and just during the one day we get 115,000 refugees. They just crossed the border between the Iraq and Syrian.
Yes.
It's just 10 kilometers from here. And it was situation and their condition was so bad, so nobody could just be silenced. So we tried to help them. We asked the authority for the absolutely the worst refugee camp, and they show us this one, and it was true because still after the 4 months the situation here is very bad. So we started to help them to give some kinds of the health care to these kind of people here. We started a bakery to give them some bread because
very nice.
It was not nobody else here to give them anything. So it was like that, and when you started the job you cannot leave that. So just we continue in that one because they have just us. We have created a lot of the expectation. Our presence here, they give them some kinds of the hope because they know the world has not forgot them. So it is just like that. And we are here is absolutely the more, I think, valuable time in my life is to be here. To save a kid's life is the absolute the best thing which can happen me. And I am very happy that I have this opportunity to can help these people and try to make their life a little bit more easier for them in this part of the world.
And your message for other doctors and other physicians and who are watching this program, what's your message for them?
It is very easy. We need help. We need your help. If you cannot be able to come here and help us, maybe I understand that there is many other problems, but please, we need the economy resource to can help them. We can buy everything here, but what we miss is the money. We have not the money to help them. The people here, they working, they are from the camp. We are not be able to give them any salary, even is in the little bit, maybe $200. We have not an economy to pay them, and they working here day and night. So we need your help.
Thank you, doctor.
And as you see, we got the help from the Norooz Foundation, and thank you for that one. Today we were able to buy medication for our refugee here. So as you see, we got all the medication.
Oh. Well, these are the medicine that are purchased with a gift from the Americans in United States. Today's some of the medicine are the donations that they were able to buy. Interesting. Okay, so these are all medicines that we were able to, with the donations from United States, and we were able to get. Okay. Well, I'm glad, doctor. I'm glad that there was a small contribution.
So we thank you very much for your help and the donation. They can help us 2-3 days to be able to run our clinics here. Because as you know, the doctors without the medication, they cannot do many things.
Yes.
They need the medication, really medication, because they have very serious disease here. Pneumonia is a killer, you know, so we have to get the help and give them. Thank you.
Doctor, I'm sorry, we did not come here earlier. We didn't know about your clinics before, but now that we know, we're going to do our best. Can I visit your clinic for a few minutes?
Absolutely. Just follow this gentleman.
Okay,
can you
thank
please
you.
show him? I can show you.
Thank you.
Open that one as well.
شنو؟ I am Bahman. اسمم بهمنه.
طارق بنادية.
طارق من بهمنم.
This is our pharmacy.
This is nice.
Yeah, this pharmacy, so we have tried to.
And we have no electric because of the.
No, we haven't any electricity, unfortunately.
Should we? Do you think we should we get a generator? Would that be okay?
It'd be fantastic if we can get help for to buy a generator.
Well, we can.
Okay,
we can do that.
thank you very much.
So this is all the medicines.
As you know, because to manage the medication is very, very sensitive question. Because the temperature here is going up and down. And
Yes.
even if they are the refugees, so we should give them the secure medication. We cannot give them anything. So we not accept anything with the expired. We should absolutely be sure that this medication, they are not harmful and they have not expired. It's very important, and it should be managed in a very good way. So we have a guy here who do that job.
Very nice.
And unfortunately, we cannot have the medication which need to put in the refrigerator because we have not electricity and not refrigerator here.
Okay.
So I'm very sorry, we have no insulin here as example, but we have a lot of the patient here with diabetes, but unfortunately we cannot have it here because of the conditions here.
I see. So this is one of this is basically your pharmacy?
Yes.
I see.
Yeah.
Okay.
And then we have two places to visit the patients.
Okay.
Hello, hello. Come on, you know, Okay, we continue here.
Okay.
Yes, here is the doctor's office, what do you call it? So we used to have the people. We have already a patient here.
Choni.
Just I have to ask him.
Okay.
Okay. I'll just ask him if it's okay to record the movie here about him, but he says okay, so you can continue.
Choni, how long you been here? چند روز اینجایی؟
بیشتر چند روزه کن کاتینه بره؟ وی کمپی؟
وی کمپی؟ یعنی هم هر تقریبا
Okay. He has been in this refugee camp since 15th of August.
15th of August?
Yeah.
Okay.
So, you see, we have not another place to hospitalization in. So he has a lot of the pain and fever, so we try to help him, yeah?
Okay.
And as you see, yeah, it's like this, so we in here.
Okay.
Okay. And we have one more cabins. As you see, these cabins we have get from the some donators, some oil company, and the other people. So we are very happy for that one, and they help us with that.
There are so many children, doctor, here.
I told you that 70-80% of the people who living here, they are children, yeah? And here is our pediatrician, he used to be here. Is here, as you mentioned, it's very cold here because we have not electricity, and we are very worried about to examine an infant here in this is not okay. But what we can do, it is the only.
How about if we get a generator, would you be able to provide kerosene, or we have to?
No, we have them. We can get the fuel from the government, but we need that one for the generator. So yes, we have.
Very nice.
Okay, we have serious medicine, but we can give them some kinds of the health care. But as you see, it's very cold here.
Yes, yes. So thank you, doctor. Again, thank you for your kind heart, and thank you for taking this big mission. You know, as a just as a physician who took care of one hospital, now taking care of almost 18 to 20,000 people. This is a big project.
Thank you very much. Thank you, the Norooz Foundation, for your help, and all other friends in which they sent us and donators. So thank you very much for your help. Thank you.
Thank you, doctor.